Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Good morning, it's 9 o'clock. Welcome to our programme this morning. The state of the NHS in England is being described as a humanitarian crisis. This winter has seen a huge strain on hospitals. In 1 week last month, 4 out of 10 hospitals were on major alert status. And there are constant calls, as you know, for more funding. A BBC survey out today suggests half of you think the quality of the NHS in England has been getting worse over the last 6 months. Through the programme this morning, we will hear your experiences and ask if you have solutions.
My name is Anita Sugavanam. I am a full-time NHS consultant in anaesthesia, so I'm representing the senior tier of clinicians on the shop floor and saying we just cannot provide safe care anymore for patients. We're being forced to make really dangerous decisions every day. The pressures are unfathomable and we are heartbroken, exasperated and demoralised.
Hello, my name's Sunny Tusi. I've been in the NHS as a clinician for about 10 years. We've been asked to deliver a lot with very little money, very little resources, and to be honest, it's quite demoralising.
Hi, I'm Priti Vyas. I'm a patient within the NHS. I've had great pre-op care, but post-op it's gone downhill from there. It's easy to see the staff are demoralised, they're tired, and it reflects on us patients.
I'm Marissa Holden. My mum was diagnosed with blood cancer not that long ago. I think the NHS is absolutely fantastic. The care from cleaner to nurse to consultant, amazing. I would fight to keep it.
Thank you. With us here in the BBC Cafe this morning, as you can see and hear, an audience of around 80 people who all either work for the NHS or have direct experience of it as a patient. And you can share your own experiences wherever you are this morning. Here's how to get in touch.
You can email us on victoria@bbc.co.uk, tweet us at Victoria Live, on Facebook search Victoria Derbyshire and text 61124. Text will be charged at the standard network rate.
Hello, good morning. Welcome to our programme. We are live until 11. A little later in our second hour, we're going to talk about some of the really difficult decisions the NHS may need to make in the future. Should it begin to charge for more services? Should we pay more in national insurance to fund the NHS? Your views welcome. Use the hashtag Victoria Live. It's our top story today. NHS hospitals in England will have a legal duty to charge overseas patients upfront for non-urgent care if they're not eligible for free treatment. From April this year, so-called health tourists could be refused operations unless they cover their costs in advance. Emergency care would still be provided immediately and billed later. Here's our health editor, Hugh Pym.
Hospitals are already supposed to charge those foreign patients who don't qualify for free non-urgent care. But a report by the National Audit Office found that money raised next year would fall far short of a £500 million target set by the government. Ministers have announced that from April, NHS trusts in England will have a legal duty to charge up front for non-emergency care rather than send invoices after the event. It's not clear how this would be enforced. A UK-wide poll of just over 1,000 adults by Ipsos Mori for the BBC shows that 74% of respondents support increasing charges for visitors from outside the UK to help fund the NHS. 40% said raising income tax to finance the NHS would be acceptable. 37% said it would be acceptable for UK citizens to pay some health services which are currently free. Hugh Pym, BBC News.
And Hugh is here, and you were on the phone to the Department of Health literally up to 5 seconds before the start of the programme. What does this mean in practical terms?
Well, Victoria, I asked the question, does it mean new legislation? And the answer is no. What we're told is that it will involve so-called secondary regulation. In other words, things that are already there, trying to make hospitals do more to charge people up front who come from outside the UK who don't qualify for free NHS care. But no detail on how this will actually work. We're told it'll be aimed at supporting hospitals to chase up the money. Some hospitals already do it and do it quite effectively. Some hospitals ask for ID when you go in to show whether you're eligible or not for care. But what the government can actually do more than what's happening at the moment, it remains a bit unclear. And they have been criticised for not raising the £500 million per year they said they would next year. It's fallen far short so far, according to the National Audit Office.
Will it affect EU nationals?
Well, there's another strand to this, which is that if you come from another EU country to the UK and you need healthcare, you've got your EHIC card that everyone is familiar with. Then hospitals should take the details, send them to the Department of Health, who then chase up the government that the visitor has come from, the nation that the visitor has come from, to get the money back. But hospitals and the Department of Health have not been very good at pursuing that, so there's an inefficiency there. Some will say, actually, this is just a couple of £100 million a year we're talking about. The NHS in England spends more than £100 billion a year, and it's really a bigger question about more funding being required.
John Boy in Croydon says, should our NHS be the hospital of the world? Should the UK taxpayer pay for the incompetencies of other nations, often because of corruption? I agree that overseas users should pay, but how is the challenge? And Laird says on Twitter, the UK is a soft touch. We need compulsory health insurance for UK visitors. Obviously, we're going to talk about this issue during the programme this morning. Your views welcome. Do get in touch. Use the hashtag #VictoriaLive if you're using Twitter. This morning, we are talking about the state of the NHS with you and with an audience of 80 NHS staff and patients. The NHS is one of those institutions that most of us cherish and cherish dearly, but are the pressures on its resources at breaking point? In recent weeks, we've heard claims that it's facing a humanitarian disaster. Hospitals on major alert status, visits to some A&E departments being up 30% on last year, patients being treated in hospital corridors because of lack of beds, and so on and so on and so on. A BBC Ipsos Mori survey out today suggests over half of you think the NHS in England has got worse in the last 6 months. Just 8% think things have got better. Is that a fair reflection, though? Let's hear from you this morning, and of course, wherever you are in the country, you are very welcome to get in touch with our programme, as you know. Hello, good morning.
Good morning. My name is Siobhan Jordan. This is my 29th year in the NHS, and I absolutely support what my colleagues are saying. The NHS is in an absolutely devastating position. However, I am here because of the commitment of the frontline staff, the nurses and the doctors. The commitment remains, and it is not down to them, the state of the NHS.
What's your job?
I have been chief nurse in 3 acute hospitals. I've worked for the Care Quality Commission, and I've inspected a number of hospitals. And in inspecting the hospitals, even the hospitals that go into special measures and come out inadequate, they are packed with incredible nurses, doctors, physios, radiologists,
What's
porters.
going wrong then, in your view?
Well, actually, there's not very many politicians here today, but there's something going fundamentally wrong, and it's not with the clinicians.
Yeah. What is it? What is it in your view?
There's a number of things. Well, clearly funding's going wrong. There's not enough funding, and the funding that there is going in the wrong places. And you're going to talk about social care later. But there's an issue with funding, there's an issue with access, there's an issue with inequalities. It's different across the country. There's particular issues in London, there's issues up north.
Okay.
Where there's...
Who agrees with Siobhan? Yeah. OK, yes, hello.
Hello, my name's Emma Hammett. I trained as a nurse back in '85. I've also worked as a hospital manager for a good few years, and now I run a first aid training business, recruiting and benefiting from the demoralisation in the ambulance staff because the paramedics are now wanting to be treated better. One thing I would say is that the NHS must be managed by people that have been within the system, they know the system, and they understand the system.
So is that what's going wrong? Poor managers, or managers with not enough experience, or incompetent managers, or managers who are snowed under completely?
Being a hospital manager is a horrendous job. And as a hospital manager, we had a lot of external big management consultants come in with amazing solutions that just don't work in a very oversubscribed situation.
Okay. Your own experiences, yes, hello. Hi.
My name's Carolyn Gammon. I'm a patient. I was diagnosed with cancer during pregnancy. I underwent chemotherapy during my pregnancy. I had my baby, she's fine, she's 9 months old now. I had a mastectomy, and my care was fantastic throughout. My problem is that after all of that process, I was then told that the drugs that I would need are not funded by the NHS in Wales. They are currently funded in England, but they're being withdrawn from England too. I'm having to fundraise to pay for the drugs to keep me alive, to be here for my children.
Wow. How much do you need to raise?
Well, my target is £150,000.
Oh my goodness.
That's for 1 year on 2 different drugs.
Wow.
It's, you know, the care has been spectacularly brilliant. I can't complain about anything, but to get to the end of that process and reach a point where you think you've had the worst news possible, to be told you have incurable cancer, and then discover that the drugs that are available, that do work, that are effective and proven to be effective, you're not going to be given access to them.
Because they're too expensive?
Because they're too expensive.
And what's your frame of mind about this situation that you find yourself in?
I don't know who to be angry with about this. I mean, I can't blame the NHS. It's not their fault. They're working within ridiculous budgets. The only place I can lay the blame is with the government.
We do have a Conservative MP here. We will talk to him in a moment. We did, of course, ask England's Health Secretary Jeremy Hunt to join us. He wasn't available. Hello, sir.
Hello there. My name's Steve Wilmot. I'm a patient.
Steve, bring that microphone a little bit closer to your mouth.
Sorry. Yeah, my name's Steve Wilmot. I'm a patient, and last July I was actually diagnosed with an enlarged prostate. As of today's date, I don't know the reason why the prostate is enlarged. I'm still waiting for a definitive diagnosis. Is it cancerous or isn't it?
Right. And what do you think about that?
Well, 7 months. I mean, obviously, if it is cancer, I would like the treatment to start sooner rather than later.
OK. But it can't be for a want of people trying to find out.
I've had a number of non-invasive tests. The next step is the invasive test, which is the biopsy.
OK. All right. Thank you, Steve.
Okay.
Yes, hello. Oh, I'll tell you what, we're going to pause for just a moment to look at the overall NHS budget and the pressures on it. Have a look at this.
The NHS is the second biggest area of public spending in the UK, behind welfare. But exactly how big is it? Well, here's how health expenditure in England has changed over the years. In 2015-16, it stood at around £117 billion. It's set to rise in the coming years, but taking account of inflation, at a less impressive rate. It's also worth noting that the UK population has increased by 5 million in 10 years. And it's an ageing population too, putting extra stress on the system. If we take the health budget in England in 2015-16, we can see how it breaks down. The biggest expenditure was on hospitals and ambulances. Many experts say the budgets for mental health services and care in the community are not great enough. In 2010-11, NHS trusts in England overall had £458 million left over from their budget. That figure rose in successive years. But since then, trusts have rapidly fallen into deficit, which means they spend more than their budget. And in 2015-16, the deficit stood at just under £2.5 billion.
With us this morning as well, you've already met him, our health editor, Hugh Pym. Also, Jeremy Lefroy, the Conservative MP for Stafford. John Ashworth, a Labour MP who is their spokesperson on health. We have the President of the Royal College of Paediatrics and Child Health, Professor Nina Modi. The Chair of the Royal College of GPs, Helen Stokes-Lampard, and Dr Chand Nagpal from the British Medical Association. As I said, we did invite England's Health Secretary, Mr Hunt, and any other ministers from the Department of Health to take part in the programme. They said no, but they did tell us across the country, we know the NHS is very busy, but hospitals... Why the laughter? No, seriously, why the laughter? Who's got a microphone? Why the laughter?
It's just blindingly obvious that the NHS is so busy. It seems like a ridiculous statement from the Ministry of Health to have to tell us that.
It goes on. The statement goes on, but hospitals are performing well with steps in place to cope with the extra demands winter brings, supported by an extra £400 million worth of funding. Sounds like a lot of money, Hugh, £400 million.
Well, if you think, Victoria, the overall budget for the NHS is more than 100 billion a year in England, it puts it into perspective. I'm not totally clear about that 400 million. I think it's recurring money that's spent every year for winter rather than being something extra this year. And what we've basically been told is the NHS was allocated extra money in successive years by this government, and it basically needs to get on with what it's got, even though it's had to cope with extremely high patient demand, as we've heard. But there is a very big question, which I'm sure we'll be talking about throughout this programme. Does the NHS need more money? If so, where does it come from? Are people prepared to pay more tax? There needs to be a debate about health and social care and whether they should be more integrated in England. That social care, of course, paid for by local authorities. How do you deal with that? There are some very, very big questions about the future here.
Hello, sir.
Well,
Do you introduce yourself?
Sorry, my name's Sonny. I'm a clinician in the NHS. No one disagrees with Hugh. The NHS does need more money, always has needed more money. And I think we live in this world now, the post-Trump world, with alternative facts. Sometimes I wonder if the DH comes up with alternative facts on their funding and how much they're given. I would like to say also, successive governments, one can blame this government now, but successive governments, because of the tax burden that is the NHS, they bring in so-called efficiency measures. And every time there's an efficiency measure, ultimately that means money has to be removed from the budget. There is nothing efficient about treating anybody. That lady there who has the cancer, there's nothing efficient about treating that lady. She needs the money. We should be able to give it. I'm pretty sure she gave taxes for the NHS.
Thank you. What I didn't mention is that I am not unique. In fact, I'm not even unusual. There are a lot of women who are fundraising, and men presumably, fundraising for cancer drugs in this country. And just this week on the BBC, it was reported that there's been a 7-fold increase from 2015 to 2016 in people on fundraising sites who are raising money for life-saving or life-extending treatments. And I think that's a ridiculous situation to be in. We can afford this. We have the money available, but the money is being spent in ways that we don't want it to be spent.
You've still got the mic, go for it.
Well, I was just saying, we've got two ministers here, one shadow minister and a very brave member from the Conservative Party from Stafford. I wonder if Mid Staffs is in his own constituency. Would they like to make some comments? And what I'd really like them not to say, well, if we were in power, we'd give more money, or we have given more money to the NHS. What I'd really like them to answer is, everyone in this room likes the NHS, they want to keep the NHS, they want the NHS properly funded. What would they say to us, who have come here today, to ask you that question specifically?
Jeremy Lafoy, as a Conservative MP, Conservative government, what are you going to say to
Well, basically, I agree. I've been, I declare an interest in that my wife is a GP, my daughter's a medical student, and as a family, we are extremely committed to the National Health Service. I've been saying since, and as you rightly say, what was the Mid Staffordshire Trust is in my constituency. I have to say that there have been great improvements there, thanks to the dedication of the staff. It's now part of the University Hospital of the Hospitals of the North Midlands with Royal Stoke. Still a great deal of pressure there. But there is no doubt, if you look at the amount that we as a nation spend on health, it's probably about 2% of GDP less than, say, in France and Germany. And frankly, unless we are prepared, and I heard people behind say they were prepared to do this, and certainly when I talk to my constituents, unless you're prepared to say we will up the amount that we spend, which means higher taxes, I'm afraid. There isn't anywhere else to go if we're going to have a system funded based on need and from a progressive source of income. That's the only way to go. And it's interesting that I think people are beginning to see that. I've been saying that for the last 3 or 4 years. I've written about it. We've seen cross-party work done in the last few weeks.
Can you see a Conservative government in can you see, sorry, I don't know who that was, a Conservative government just before the 2020 election? We've got a microphone or a fader open somewhere, we'll just ignore that. Just before the next general election, promising in a manifesto, we're going to put your taxes up in order to fund properly the NHS.
The answer is I don't know. I would
What
hope.
do you think?
I would hope that we would have a. We've got this. This is precisely.
That's your job.
This is precisely.
That's your job. Your job is to advocate for us. You are representing the people of this country. I'm a patient called Andrew who has nearly died in casualty several times from asthma.
So, would you turn around and just look at the lady who's talking to you directly?
Sorry.
Yeah.
Your job is to sorry, I still can't see you. I want to look at your eyes.
No,
your job is to advocate for us. That is your job as our MP, one of the MPs in this government at the moment. And if we're saying, and a lot of people are, I've seen lots of question times, it's the only programme I watch, are willing to pay the extra 2p on the tax, then why not? Forget the ideology of low taxations. Just let us have our NHS free at the point of delivery so we can stay alive.
You need a microphone to speak. Do introduce yourself.
My name's Gay Lee, and I've been a nurse for 37 years. I work in a hospice. There is no great mystery why hospices work. They have enough staff. The funding for the NHS, and by the way, I'm very sorry to see there are no nurse leaders here at the moment. I wish the RCN had been, the Royal College of Nursing had been invited. Okay, good, I'm glad to see it. The funding sources. My area in South East London spent £5.3 million in the last 3 years on external management consultants to advise how to reorganise services in our area. And the second thing is that...
Let's stay on the money. Let's stay on the money issue,
but the admin costs have gone up by 10% over the last 20 years since the NHS became a market, commissioning and provision of service separated.
Right, let me bring in this gentleman here, and then, sir, you need a microphone, but yeah, go ahead.
My name is Ben Harris-Quinny.
Can you move that microphone closer?
The Conservative think tank, the Bow Group. I'm very glad, sir, that you said you wanted more answers than just throw more money at it, because this debate very rarely gets beyond that, because Labour just say, oh, well, the answer is throw more money at it. I'm not saying the NHS doesn't need funding, but it's quite extraordinary, isn't it, that Jeremy Hunt is one of the longest-serving health secretaries. He's been in post for just 4 years. And really the problem with the NHS, or indeed a big problem with the NHS, is the fact that this country, for at least the last 20 years, has been governed on the basis of winning an election, not on the basis of long-term planning. Now, to the point about the percentage of GDP spending, Japan actually spends 1% less than we do on its healthcare and has better healthcare outcomes. And that's because they have a different approach. So, whilst I'm not here to say we need to cut funding to the NHS, absolutely not. That can only ever be part of the solution.
OK, well, let's hear what a Labour representative does have to say. John Ashworth, is it? I mean, again, I don't know what Jeremy Corbyn's going to promise in his manifesto before 2020, if he's still the leader. Is it going to be more money? Is it going to be, yeah, we're going to put your taxes up 2p in the pound? What?
Well, I mean, certainly the NHS needs more money. I mean, it is going through the largest financial squeeze in its history, and head for head next year, NHS investment will actually be cut in England. So you're right to say it's not just about money, but we cannot ignore the reality that this huge financial squeeze is putting this incredible burden and pressure on the system at every level now. So we can't just dismiss that out of hand.
OK, well, 2 questions in response to that. Firstly, how do you account for the fact that Japan has better healthcare outcomes by spending less money? And secondly, are you willing to acknowledge, as many of your colleagues at least have, that this country is out of money? We're told we have an austerity budget in place. No, I'm afraid it is. We're told we have an austerity budget in place. This government is borrowing 70 billion more than it's taking into the exchequer. We are 1.5 trillion in debt. When there is another recession, we will be in big trouble. The kind of trouble that Greece has been in.
Behind you, and then back to John Ashworth. Yes.
Hello. Yeah, I'm John Donovan. I work in a coastal NHS. I'm afraid that's absolute rubbish. We are the 6th richest country in the world. No, I'm sorry. Let me finish my point. I'm afraid the government gave, and it's all faults, it's Tories, Liberals and the Labour, gave, when the bankers' bailout, 109, listen to this, folks, not million, not billion, but trillion pounds. That could have funded the social care for 100 years. It could have also done the NHS for 50 years.
Okay,
so
John,
there is
we'll come
money.
back in
It's
here.
all about ideology and the fact that the Tory government do not want to do it. And we should stand up against it.
Thank you.
We didn't
John,
spend 109 trillion bailing out the banks. We absolutely did not. No, we didn't spend 109 trillion. No. I'm sorry, sir. We didn't spend 109 trillion.
John Ashworth, Labour MP.
The gentleman from the Conservative think tank. This government has found billions to cut tax for big corporations, has found billions to cut share transaction tax, and in the recent November budget, it found millions to build new grammar schools and not an extra penny piece for the NHS or for social care needs of the elderly
So what would
in
Labour
our
do?
community. It was a disgrace, really. And to say there's no money available is a nonsense. We need to put investment. We need
Please,
to put,
please.
We need,
If
we
you
need
don't
to
have
put
a microphone,
investment.
don't speak.
We need to put investment into the NHS. Government is about choices. It doesn't need to choose to cut corporation tax for billions. It doesn't need to choose to put millions into building new grammar schools.
OK, what would Labour do?
Well, we would put more investment into the NHS. But on the point that
Where would that come from?
Well, I've outlined some suggestions about which this government doesn't need to be doing. But yes, I think this country needs to engage in a big debate about the future financing of the NHS. Because as we get, as a population, we grow older with more complex needs, which is a good thing. We're all living longer, by the way, and we have more expectations on the NHS. We're going to have to debate and face up to some big questions about how we fund it. But let's not go for the nonsense and believe that the NHS could not have extra investment now. It could if this government took a different set of decisions.
OK.
My name's Rishi. I'm an orthopaedic surgeon in my last year of training. So I've sort of been privy to budgets and cuts over the last a few years from a frontline point of view. Just the gentleman from the Conservative think tank, bravo, you argued your alternative facts, very vehemently and, presented a very convincing case. But the fact of the matter is you're talking about not putting in extra funding. This is a very political decision. It's not about not putting in extra funding. It's the cuts that you are making on a very real case every single day. This is like a bucket, the purse of the NHS, where there's holes in it, and these holes are only increasing on a daily basis. We see money being siphoned off to private finance initiatives. They didn't mention that, £80 billion pounds for private finance initiatives for buildings, which were meant to cost 11 billion.
That was the previous government. That was the previous government.
I'm not going on about government things.
Sure.
I'm talking about funding. I'm talking about loss.
Okay.
So forget. You can keep putting water into a bucket, but if you continue to put holes in it, if you are siphoning off money, since the Health and Social Care Act in 2012, that opened up budgets for hospitals to make 50% of their income via private companies, via private initiatives as well. Money is being lost through ridiculous means every single day. And I see this as a doctor as well, because we are having to ration the services we give to certain patients.
Like what, for example?
So, for example,
tell us about your daily...
So, for example, as an orthopaedic surgeon, there's certain people now who I will be able to offer hip and knee replacements to, who I would have been able to offer them 5 years ago, and now I won't be able to. So when you talk about the lady, absolutely tragic story, that's one thing about drugs available for cancer. The next thing you'll say is, well, people who are obese shouldn't be allowed to have certain treatments. People who are smokers shouldn't be allowed to have certain treatments. It will go on and on and on, and that's what will happen. Private companies are looking at profits, and they are beholden to their shareholders before they are beholden to the public.
Something like 7% of the NHS budget goes on independent/private providers. Compared to the whole,
so what I'm talking about to you
it's
is,
not that very.
What I'm talking to you though is I'm saying to you that I don't think slapping up taxes and bumping in loads and loads of money is the way, necessarily just the way forward.
Okay.
We spend 0.9% of our GDP at the moment, 0.9% increase per year, as opposed to a 4% increase before 2010. In line with an inflation, that is a very real cut that we are seeing every single year.
Okay. By the way, on the figure about banks, there are various reports, but it's around £1 trillion. It's a lot of money. I accept.
9 trillion.
Yes, that's what I'm saying. A trillion. 1 trillion. 1 trillion. Hello. Yes, you. Good morning.
My name's Anita Sugavanam. I'm a consultant anaesthetist in the NHS. And just a couple of points I want to make. People talk about absolute numbers, 10 million, 4.5 billion. And actually, I'm not a health academic policist, but I do know that actually what you need to talk is related to the percentage in GDP, the head-to-head spend, the fact that are we talking about the fact that we're accommodating the increasing ageing population, the fact that there just are more sick people around. If you give me a number of 10 billion, I don't know what that means. And so
You
the public
said at the
needs to
start of the
understand.
programme, Anita, sorry to interrupt, that you, in your job, were making dangerous decisions.
Yes.
What do you mean by that?
I speak on behalf of pretty much every NHS consultant and GP, and we've written an open letter to the Prime Minister. It's been signed by around 2,000 consultants and GPs across the country, north, west, south, east. And what it is saying is, number one, we are in a crisis. This isn't a seasonal pinch. We have never, ever been in such dangerous territory. The decisions that we have to make are, frankly, unfathomable.
Please give me an example.
So I'll say we come to work every day and we're on black alert. I don't even know what that means anymore. It's just another name. It's a daily, permanent sort of fixture. I have to tell people on a daily basis that their operation for stomach cancer is cancelled for the 3rd time because there is bed blocking due to medically fit patients who cannot access social services and because there are more sick people in the acute services. The GPs are at busting point, as are the acute services, and they're having a negative impact on each other. And what's really worrying is the brain drain. Nurses and doctors at junior level and senior level are starting to leave.
So the danger... Sorry, again to interrupt, sorry.
That's all
The
right.
dangerous decision is saying to that patient, you can't have your op today because there are no beds. We could do the op, but there'd be nowhere to put you. And that is dangerous for that patient.
So that's dangerous and heartbreaking for me. I did not train to do that. And number two, I would say, is what the dangerous decisions are the fact that there are fewer doctors and fewer nurses. So the doctor and nurse to patient ratio on wards and intensive care is you cannot imagine the stresses we go through.
Okay.
It is unimaginable. And the fact that we are looking after patients who are very sick in unsafe areas in the hospital. You hear about the trolleys. We are making decisions where we go home at night and, frankly, we don't sleep.
You can't sleep because
No. Yeah.
Okay.
Did I do the right thing? Did I discharge that patient? Was it too early? Should that patient, my junior doctors are acting as nurses and doctors at the same time because there aren't enough staff on the floor. And junior doctors are leaving. And frankly, I don't blame them. And we're starting to leave. I'm having conversations in corridors with colleagues, consultant colleagues, about make that phone call to Dubai. Why don't we talk about moving to Canada, Australia?
Okay.
This never happened before.
Right, let's keep this conversation going. Hello, yes, do talk to Anita.
So I would completely agree with you, Anita. As a NHS frontline nurse, and have been for the last 10 years, I've literally just seen the kind of services just getting increasingly more pressured, increasingly more dangerous situations that we're having to make life-changing decisions for patients. And also, it kind of feels really demoralising as a member of staff to be told continuously by Jeremy Hunt and the Department of Health that they're putting more money into the NHS when in reality that's a £22 billion cut to the services. Yes. So we're not stupid. We're really...
Stay there. Gentleman here, hello. Do join us.
I'm Dr Dean Eggett. I'm a GP from Doncaster. I just want to echo really what my colleague in the hospital is saying, but similar in general practice really. There just aren't enough doctors to cope with the patient and the patient needs. The patients are getting sicker, they're living longer, and there are more of them. In the morning, I will turn up to work at 7:30 in the morning, and I will have approximately 100 pieces of paperwork to do before my patients start phoning through to me at 8:30 in the morning. Between 8:30 and lunchtime, I can consult with approximately 50 patients. For the rest of the day, that might be another 25 to 30 patients. By 10:30 in the morning, my brain is fried. I just can't think anymore. It's not safe for patients to contact me, and I advise them at 11 o'clock in the morning, you know you're not getting the best of me anymore. It's dangerous to phone me from here on in, and I don't know what else to do because there aren't enough staff to care for these patients.
Okay, well, I mean...
That would be my other point, really, and I completely agree with you. What have we been doing about workforce planning for the future? By 2020, we're going to have a complete shortage of nurses unable to cope with the demands that we're having to experience from the public.
Can I just say, in addition to that, obviously the NHS bursaries have been cut for nurses, so we're now not recruiting them. This year alone, more than ever before, more foundation doctors, so junior doctors about to embark on a career in specialty training, have left. More than any other year. And I can tell you personally, I'm having to cover more gaps on the junior doctor rota than I ever thought was going to be the case. In fact, I didn't think that was part of my job plan. But there are holes. We come to work every day and there just isn't a medical registrar.
Okay,
there just
I'm going to read
isn't
some
a
messages
surgical
from
one.
people around the country. Sue via Twitter says, I'm a frequent user of our NHS. I can't praise them enough. Let's keep it, please. Jeff texts from Southampton. There are ample funds in the NHS. It's about bad management and bad procurement practices. On Twitter, PSW 2004 says nurses and doctors are excellent, the problems are elsewhere. Too many chiefs, not enough beds. This texter says the NHS resources cannot keep up with rising demand. Should demand, due to self-indulgence, e.g. obesity, be given a lower place in the queue? Something we're definitely going to talk about. A few gasps from the audience here, but something that we're definitely going to talk about through the morning. Thank you. Good morning. We're talking about the state of the NHS today with an audience of around 80 NHS workers and patients and your own experience wherever you are around the country. For the next quarter of an hour or so, we're going to talk about social care and the impact that stretched resources there have on the NHS. Healthcare, as you know, provided by the NHS in doctors' surgeries and hospitals. Social care is provided in the community to help people who need support because they're very ill, they have disabilities, they're elderly, and because so many more people are living longer. It's really putting pressure on the social care budget, which in 2016 stood at just under £20 billion in England.
The social care system is designed to provide care in the community for the elderly, sick and disabled. It encompasses anything from help in the home with washing and dressing to care homes, and has remained more or less unchanged since it was created after World War II. Nowadays, people live on average 10 years longer and with more complex conditions that require additional care. But support is not rising, it's falling. The Local Government Association estimates the gap between the care budget councils receive will be £4 billion short of what's needed by 2020. Some experts have called for the care system to be merged with the NHS, but it's known the government has little appetite for more structural upheaval. The result is that councils are left to limp on. Many people with care needs are forced to pay for it themselves, rely on friends and family, or go without. The Prime Minister has, however, promised a long-term sustainable system.
By the end of this Parliament, local authorities will have £3.5 billion more to spend on social care. And of course, we're putting more money into the health service as well.
The government's offered local authorities the opportunity to bring forward council tax rises to help cover social care costs and money redistributed from the New Homes Bonus Scheme. Over the next 2 years, the government says it could mean an extra £900 million is pumped into the social care system, but charities have called it a drop in the ocean.
And you might have heard this morning, an NHS trust has apologised after an 89-year-old woman remained on a ward for 6 months at a cost of more than £80,000, despite being fit for discharge. She was all right to go. There was just nowhere for her to go. Iris Sibley is her name. Initially admitted to hospital after a fall at a care home in June. She and her family were left distressed and let down after multiple attempts to move her into a nursing home failed, leaving her in isolation, effectively, at the Bristol Royal Infirmary. I wonder how regular something like that happens, or if it is one of those extreme examples. Let's hear your own experiences of social care. Morning.
Morning, my name's Barry Couchman. My mother had to go into social care through dementia, which she was paying for.
So a nursing home, a care home?
Care home.
Yeah.
One Saturday morning she had this bout of sickness, and the home kept us informed through the day up until Saturday evening that they said she's no worse, she'll be fine, she'll get through the night. That was the last call we got till 7 o'clock Sunday morning when the hospital phoned us to say that she'd passed away.
Oh, God.
That she was discharged to the hospital without any of her medical records. The hospital tried to phone the home, couldn't get any answer on the phone. The police went down there, couldn't get any answer. When the morning shift come on at 7 o'clock in the morning, that's when the police got some response from the night staff. We found out that, you know, if we'd been informed that my mother was in hospital, one of the family could have sat with her, and she actually choked on her own vomit and died in A&E.
Oh, my goodness.
And we was paying for 24-hour care. But as I say, any member of the family would have willingly sat with her in A&E.
Of course. So how did your family respond to what happened to your mum?
What could you do? You know, I got in touch with a solicitor to sue the home for negligence. He said, forget it, you're not going to get anywhere with it. He gave me a figure of less than £1,000 we'd get because we're not dependent on her. But the thing was, we wanted to take it further to prevent it happening again, but he just said it'd cost you thousands to prove a point and most probably won't get you any further.
Yeah, understood. Lady of here, hello.
Hi, my name's Lindsay Poole. I'm a home care support worker. I work with people who are discharged from hospital, enabling them to remain in their own homes following a period of illness. I work with a caring, compassionate team who go above and beyond what's asked of them. I think our concerns are the shutting of the community hospitals. There's nowhere for these patients to go once they've left hospital. Therefore, due to bed blocking, they're being discharged too soon and ending up and being readmitted to hospital.
Right. So I wonder what needs to change. Yes, hello, good morning. Do introduce yourself.
Hi, I'm Professor Helen Stokes-Lampard. I'm Chair of the Royal College of GPs, but I'm a GP myself in Lichfield in Staffordshire. And this is bringing back examples that I've seen in my practice, and I was there till late on Friday, I'll be there this afternoon. Examples where we see patients either sent home too soon without the care in place, or people being trapped in hospital, unable to go to a safe place because there aren't the places there. And the NHS is entirely dependent on social care. If you think of it as a three-legged stool, you've got the community care, the social care, and then the hospital care. We all have to work together, and if the whole system isn't funded and supported appropriately, we all fall down. So we're all in it together. And it breaks my heart when I have a patient at home and I can see them deteriorating and needing care, and I know that with the right care package in place, they wouldn't need to go to hospital. The joy of being a GP is that we can save people getting to hospital if we've got the right support structures. We conduct this orchestra of wonderful people in the community, and with a bit of family support as well, we can work miracles, but we can't work miracles without any resource, and it's a difficult time for us all. I really feel for you guys, but you do amazing, amazing work.
Dr. Chan Nagpal is here from the British Medical Association. What's your view when it comes to social care?
Yeah, I think this debate really is about the health and social care system being part of a single organisation, which is, as we've heard before, woefully underfunded. And coming back to the hard facts, the real facts, the truth is we do have fewer hospital beds than any other European nation. Germany has 3 times as many hospital beds, 3 times as many. We have the lowest number of doctors. Social care funding has been cut year on year for the last 6 years. And therefore, when you actually try and look after an older population with multiple health problems, you simply can't deliver that whilst you have a social care system that is cutting costs year on year. So there has to be, this has to be addressed as a global issue about looking at the total resource.
Well, I don't know about a global issue. I mean, Surrey County Council, for example, is having a referendum amongst households to see if they would pay 15% extra on their bills to pay for social care.
I think we need to remember this is a national health service, and the minute we start leaving it to local areas to sort out a national problem, I think we've lost.
Let me bring in Professor Nina Modi, President of the Royal College of Paediatrics and Child Health. Morning.
Thank you very much, Victoria. I'm also a frontline clinician. I look after sick newborn babies, and last year about 1,000 babies were transferred, sick babies were transferred unnecessarily between hospitals because there were insufficient cots. That's just one fact that I want to put out there. But I also want to pick up on the point of the ageing population. Let's talk about the healthy ageing population, because, of course, the burdens that are placed upon the health services come because we're having an ageing population with complex needs. But what is it that would help us all live long and healthy as opposed to unhealthy lives?
Tell us, please.
Well, it's about prevention, isn't it? It's about health in infancy. And we have not yet spoken about we've only spoken about the acute health services. We've not spoken about the terrible cuts that have been inflicted on public health, most of which burden is, I have to say, being imposed upon children. 14% of the £200 million in public health cuts last year are falling directly upon children's services. Health visiting, sexual health for young people, obesity prevention, anti-smoking. All of these things are the things that will lead, if they are not prevented, to chronic lung disease, obesity, dementia, many cancers further down the line. So it would be really good to talk about prevention when we talk about the health services as well.
John Ashworth, Shadow Health Minister.
Yeah, well, I agree with all these comments, and I'm so pleased we're having a debate about social care, because you simply won't solve the problems and the pressures facing the NHS unless we solve the social care crisis in this country.
And does that come from the top? Does that come from government, as our guest here said, or do you think county councils who are responsible, or councils who are responsible for social care, can make their own arrangements?
It has to come from the top. The government have taken out billions and billions from social care. 400,000 very elderly and vulnerable people are not getting the kind of social care packages that they would have done. That is putting these huge pressures on the NHS itself. It has to come from the top. And in the budget in March, the Chancellor has to do what he failed to do in his mini-budget in November, bring forward some emergency funding for social care.
Okay,
because the way we treat elderly people is a disgrace in this country at the moment.
Jeremy Lefroy, as a Conservative MP, was it short-sighted of the then coalition government to make the kind of cuts they did to social care?
I think we've seen this increase over the last couple of years when there has been a lot of pressure.
Was it short-sighted then?
Yes, I would say it is short-sighted. I think social care has always been the poor relation.
And would you back Mr Ashworth's call for your Chancellor to bring forward emergency funding to help councils pay for social care? Or are you happy to see councils put council tax bills up, as many of them are going to do?
I think we absolutely do need some emergency funding. I don't see a problem with councils putting their... I mean, we've had council tax freezes for about 4 or 5 years. I think it's important that those council tax bills start to go up again in a measured way, which is what they're doing, for instance, in my county, if I can just finish.
Sorry.
But also, I think we do need some emergency social care funding, because what we're seeing, as I think everybody here has said, is people staying far too long. I've seen that in hospital beds. I've seen that in my constituency surgeries. And I'm sure every colleague in Parliament has seen the same.
And when you say emergency funding, John Ashworth, how much money are you asking that the Chancellor
Well, I mean, there's
put
different
in?
estimates about what's needed. I noticed in the package they were talking about 2 billion. I, for example, have suggested that there's an extra 700 million allocated in 2019. Why not bring that forward? I mean, look, I'll leave it to the Chancellor to do the sums, but we need some money.
All right, I'm just going to ask you to pretend for a second that you are all residents of Surrey County Council. As you know, they're having this referendum. They're going to ask their own householders, do you want to pay an extra 15% on your council tax bill, which will go to social care? If you were Surrey residents, would you say, yes, I'll go for that 15%? If you would, put your hand in the air. Go on, tell me what it is then. Give the microphone to that lady there.
The problem is with referendums and asking the questions to the public is we're not given enough information, we're not educated enough to be able to make a choice.
Okay.
So yes,
there are people here who put their hand up to say, yes, I would pay the extra 15%.
But how can you guarantee that that 15% is actually going to go to the front-line services?
Yes, introduce yourself.
Hello, Wendy Preston, Head of Nursing Practice from the Royal College of Nursing, and I exactly agree with you, it's the wrong question to ask.
OK, they're asking it, whether we like it or not, they're asking it.
OK, but if we get this extra money, how are we going to spend it? How are we suddenly going to be able to have all these services? Our members have been telling us that these are not isolated incidents. They're telling us that day in, day out, nurses and doctors are having to send patients home from hospitals into their home when there's not enough care.
Okay.
And we know that we've got less community nurses. There's a 40% drop in district nurses. We've got 24,000 nurse vacancies. So we need some long-term solutions. It's not just about throwing money at this problem.
Yeah. You, sir, hello. Welcome. You said you would pay an extra 15% on your council tax bill.
Yeah, well, I don't live in Surrey, but I would. Well, having said that, I think that the problem is going to be poorer parts of the country, Middlesbrough, Newcastle, other areas where people can't. 15% is going to be a significant amount of money. It's all very well in Surrey, where generally speaking, the economic, prosperity level is higher, but it's not right for the government to push this problem onto local councils. It needs to be funded centrally and needs to be funded properly.
But you would pay that extra on your council tax bill, so apparently you wouldn't.
Well, no, I absolutely would. I'm Alex Wild, I'm from the Taxpayers Alliance, and Surrey is a particularly egregious example. I don't want to make it all about Surrey, but there are lots of councils who are coping with this far, far better than Surrey, so it's not a good example.
But there are lots of councils who are going to increase bills up to the maximum that they're allowed under government rules to just under 5%.
But 15% is quite absurd, and it's quite clear that some councils are far better at this than others, and some councils are far, far better at keeping people sort of in their homes and out of care homes than others. So there does need to be a kind of learning from best practice across councils, because some are coping far, far better than others.
OK, fair enough. Yes, Hugh?
Yeah, I think this is a really crucial point here, and it's interesting to see in Scotland health and social care is now integrated, but it will take time to actually get social care run by local authorities and the NHS working closely together. So they started in Scotland. It hasn't happened in England. It happened in Northern Ireland a little while ago. But the big point that's being made here, how can you treat social care funded by local authorities as something very different from the NHS when you have a patient with dementia, for example, who lives in their own home and who needs care but is means tested for it, whereas your cancer care is paid for in a hospital? I think all these big questions are coming up. There are examples around England, certainly, that I've looked at, where local authorities and local NHS GPs are working now together to try to make the best of what they've got, which I think can be done. But ultimately, money is involved, and is it right it should fall on council taxpayers in areas which maybe can afford it, whereas others can't raise council tax because their local population can't afford it? Does it need a much bigger long-term plan to be drawn up?
My name's June Gray, and I am a practice nurse working in East London. My father, of 84 years of age, passed away some time ago, and in the bed opposite to him on the ward was one of his best friends, who unfortunately had had his leg amputated and had been in hospital for a year because he didn't figure in the local authority radar. He didn't have any housing, he had no income except for his pension. And his nearest relative lived in Wales, in Swansea. But the authority there didn't want to take him on, couldn't find a nursing home that was suitable for him. And so he spent virtually a year in hospital with people passing the buck and saying, we don't want to fund this, we can't fund this, we can't find a place for you. Eventually it was sorted out, but the difficulties for his family, the difficulties for him, and the deterioration in his mental state through lying in hospital for all that amount of time and not getting the proper rehabilitation that he could have had. This is why it needs to be a national service, and as Helen said, it's a three-legged stool. When I was a district nurse, if I went into a home and someone was deteriorating, I could say, this person needs more help, we need more visits. When my father was deteriorating and we said to the carers, can we get more help, we had to go back to the care coordinator, they had to go to the agency.
Sorry to interrupt, let me read this message. This is Brendan who texts. Families need to take far more responsibility for their ageing parents and relatives.
Great, fine. So are you going to pay me to give up my full-time job in order to look after my elderly relatives? Because that's the reality. My mother, who is in her 80s now, and I were having to look after my father and pick up the shortfall. My sisters helped where they could, but they live far away. Families are not unwilling to do this. But we can't all just drop everything and be there.
Let me read this as well. I work in a care home, and only in the past few weeks we've had residents sent home far too early from hospital, and then they've had to be readmitted. Karen says, pay relatives to look after the elderly. It must be cheaper than care homes. Hello, morning.
The mum of two junior doctors.
What's your name?
Yash.
Yash, can you put your microphone a bit closer? Thank you.
Okay. And I just came to say just one thing, that the pressures on the NHS are also being increased because of cutbacks in the social sector, in the social funding. I have a brother who has spent an extra 5 weeks in hospital and then an extra 5 weeks in a nursing home. When he's actually got a home of his own, he just needs his social care package to be able to go back to where he wants to be, back in the home.
Must be so frustrating.
Very. And the thing is that if they had better funding for the social in the social side, then these patients don't want to be in the hospital where they can pick up more infections. They want to go back to their houses and have some dignity and care in the community, within their houses, and that would release lots of beds. So that's the main thing I wanted to say, and the NHS is great.
Thank you. We've got the news and sport on the way, and then lots more discussion in the next hour of the programme. Sally texts to say, remember that the elderly are the ones who have paid their taxes all their lives. Why should they be sidelined when it comes to treatment? This morning, the government's announced that from April, hospitals in England will have a legal duty to charge overseas patients who aren't eligible for free NHS care. We'll ask our audience here of NHS workers and patients whether the NHS should start charging for more treatments and procedures. Let's just get a quick snapshot. You're a GP. Do you think you should start charging?
I think if you start charging patients, it fundamentally alters the relationship between the doctor and the patient. Yeah. So, and that's what I really don't want that to happen.
OK. What about yourself?
Yeah, I completely agree. Definitely a no.
Definitely a no.
I think I agree with the GP over there that if you start charging, it's a slippery slope.
OK. You're a final year medical student, sir?
Yeah, I have to agree with the other guys, but from the other side of the coin, is there enough money to do that? I don't know if there is.
OK. All right, thank you very much. You've been telling us your experiences of the state of the NHS this morning. This is what some of you have been saying.
The NHS must be managed by people that have been within the system, they know the system, and they understand the system.
We are in a crisis. This isn't a seasonal pinch. We have never, ever been in such dangerous territory. The decisions that we have to make are frankly unfathomable.
I was then told that the drugs that I would need are not funded by the NHS in Wales. They are currently funded in England, but they're being withdrawn from England too. I'm having to fundraise to pay for the drugs to keep me alive, to be here for my children.
Day in, day out, nurses and doctors are having to send patients home from hospitals into their home when there's not enough care.
In the next hour, we'll also talk about government plans for a 7-day NHS. As you know, the NHS was created after the Second World War. It was 1948, with the guiding principles that it should be free to all and open to everyone at any point in their lives, i.e. that it would look after you from cradle to grave. How much of those principles in 1948 still hold true nearly 70 years later? Have a look at this.
I got pains in the tops of my leg really bad. I had to ring 999. The ambulance came and took me straight to A&E, where they told me I was in labour. And then 2 hours later, I had a baby. I didn't know I was pregnant until I got into the delivery suite, so they were very, very supportive, and they helped me with baby clothes because I had nothing, and just genuinely felt at home because of their support and how welcoming they were.
My name's Rachel. I live in London and I've had mental health problems for about 3 years since I had a breakdown when I was in my last year at university. My experiences with NHS services have been really mixed. I've had some that have been really, really helpful, but often the right services aren't there when you need them, so you can end up waiting a really long time, and that can mean things get really bad before you get any help.
I'm Lisa Stevenson, and in April 2011 my life changed forever when I was diagnosed out of the blue with multiple myeloma, cancer of the blood plasma. The NHS for me is made up because of the incredible people who work within it. The doctors, the nurses, the porters, the cleaners. Every interaction I have had has been absolutely amazing.
Oh, Soto. Oh,
Hi, my name is Jo Horton, and less than a year ago I was involved in an accident on a bus that resulted in me losing my leg. So I'm an amputee, and thanks to the NHS I am here running my own business again, teaching judo in schools. I'm a former Olympian, and judo has been my life since I was 8 years old, and the NHS literally pieced me back together physically, emotionally and mentally to get me back here on this journey. Everybody from the bottom to the top has made this journey possible for me.
My name's Leslie Goodburn. My husband Seth died in May 2014 from pancreatic cancer, and throughout that process we were put through the palliative care route and supported by a palliative care team. We'd gone from him being okay to suddenly dying overnight, Lots of the care along the way wasn't the way that we wanted it to be. It didn't really meet the kind of person and centredness agenda that the NHS talk about, and people being at the centre of the decision making. So I'm keen to share the story that Seth and I went through to improve things for others and to create a compassionate legacy in Seth's name.
Well, Labour opened up the NHS to independent, private providers back in 2002 in a system where money is supposed to follow the patient. 10 years ago, 2.8% of the NHS budget was spent on independent providers. Now that figure stands at 7.6%. Privatisation means opening the door to private providers. It's different to charging for services, which we already do for things like dentists, eye care and so on. But with a finite pot of money, a growing and ageing population, meaning more pressure on services, is it time to start looking again at charging patients for more services? Well, a BBC Ipsos Mori survey of over 1,000 adults in the UK suggests that half of you think that would be unacceptable. Around a third think it would be acceptable. So let's get a snapshot of views in the audience. Put your hands up and keep them up if you think it would be acceptable to charge for some services. OK, I'm just going to nip over here. You, give one microphone. Oh, yeah, go on.
I'm House, and I spent 26 years in the ambulance sector. One area I would look at is charging for people who choose to get drunk. Put a huge strain on the ambulance services, blight A&E.
How much would you charge them?
Oh, I don't know about that.
Well, let's talk about it. Let's talk about it.
Well,
So, and when would you charge them?
OK, so if you look at Scandinavian countries, they do charge for what they call a drunk recovery service.
OK.
About £400. They're locked in a safe place.
Per night?
Per night. They're locked in a safe place, they're cared for, and next day there's a release fee. Now,
who disagrees? Who agrees?
I agree.
You agree with the drunk bit? The drunk. What's it called in Scandinavia?
The drunk recovery service.
OK,
Yeah.
400 quid. Do you agree or disagree, sir?
I completely disagree. This is a Trojan horse argument. The NHS has been set
Tell
up...
the gentleman here who works for
Well,
the
I'll explain it to him. So they might seem like an easy target, but once you introduce the infrastructure for charging, this will gradually be extended to other groups like overweight people, people who smoke, people who injure themselves through skiing. But at the moment, the immigrants are being used to introduce charging. The cheapest way to raise money to fund a health service is through general taxation.
Okay.
Charging patients is classified as a zombie policy. It refuses to die. And what our Tory MP should be telling us is they're setting us up for an American-style insurance system. Either you can... There's two ways to pay charges. You pay out of pocket or you take out top-up insurance, and our politicians are afraid to tell us where they're taking us.
Well, I'm going to ask our Conservative MP in a second, but I want you to argue the case for what you've just talked about with the gentleman here who disagrees. Sorry, what's your name? What do you do?
Sorry, I'm Dr. Bob Gill. I'm a GP, and I'm producing a documentary to explain this scam that is taking place.
I just think it's demoralising for ambulance staff having to deal with drunk people Friday, Saturday night. You ask about the morale of the NHS. They're having to deal with people because there's no disincentive for them to go out and get drunk. As a society, is that something we want to put up with? I take your point about it being a Trojan horse potentially.
Yeah.
But that's a very specific instance where it causes misery for the NHS and money.
OK, but I am not advocating people get drunk and waste people's time.
No.
I don't advocate
Can I just check,
smoking
has anyone
either.
here had an ambulance called after having had one too many or two too many or three too many?
But this is a spurious argument. What we're having is demonising of certain groups of patients, and this will be extended, and we're falling into a trap.
I want to bring this lady in. Hello.
Sorry, hi, my name's Jess. I'm an A&E doctor.
Hi, Jess.
I have to agree with you. I stand on the front line, OK? I'm the person who gets assaulted, who gets sexually assaulted in A&E by drunk people. I was a medical student. You've seen us all on TV. We go out and get drunk all the time. I've never ended up in A&E. None of us have ever ended up in A&E. Also, I've never left my friends behind on the side of the road, drunk, which people do now. We should be charging them. It costs inordinate amounts of money. It's £300 every time we send LAS to go and pick somebody up off the side of the road. And then the money that you get charged, just walking into A&E is £100 to register you. It's a waste of money and it's ridiculous.
Jess, can I ask you the nature of the assaults upon you, if it's all right?
So I've been punched in the face, I've been held up against a wall by my neck, I've had nurses who are awesome dragging people off me. Most recently I had someone grab me by the breast in the waiting room. And that's going to court. And that's because I work on the front line in A&E and all of those people were drunk. None of them were mentally unwell. I've been assaulted by mentally unwell people too, but all of those people were drunk and not in control of themselves. That doesn't make their behaviour acceptable in any way.
OK. All right, so you charge, sorry Jess, you charge what, 400 quid? Does that sound reasonable?
I don't know. I think it would be something that we'd have to look at how much it actually costs. So in Cardiff, where I used to work, they have an actual drunk tank. You don't even come to A&E anymore. The LAS, who are incredibly highly trained professionals, say, you're just a drunk person. Go and lie on that bed for a while, and then matron will kick you out in 2 hours when you wake up and feel sorry for yourself.
OK, all right, interesting. Let's move on to the next question on this survey. 3/4 of people questioned in this BBC Ipsos Mori survey of over 1,000 adults support the idea of charging visitors from outside the UK for health services they receive from the NHS. As you know, the government announcing today that foreign patients will have to pay up front for non-urgent care. Who agrees with that? Hands up and keep them up. So I can just... Yes, hi. Stand up, come on, come on.
Hello, my name's Joanne Smith. I'm a medical secretary in the hospital for 23 years, and I've also been a patient over the last 2 years through breast cancer, chemo, radiotherapy and 2 operations, as well as supporting my dad with lung cancer. And as a family, the money that we have had out of the NHS, and my brother broke his kneecap as well, we were all in hospital at the same time at one point.
Goodness me.
All going to theatre. Me and my dad were on the cancer ward having chemo together. The money as a family that we have had out of the NHS, I would not like to know. But my dad is 70, he's run his own company, he's worked every single day since he left school. The same with me and the same with my brother. And we owe our lives to the hospital. I work as a medical secretary.
And
I give above and beyond.
Yeah. And you support this move that it's been brought in today?
And I support.
A legal duty on staff to charge
I
foreign
do,
patients.
yes.
OK.
Because
who disagrees with that? Who disagrees with that? Sorry, where's Amber? I can't see you. Oh, sorry. Yeah, hi.
Hiya, my name's Oliver. To be honest, I disagree that people that come to this country should have to pay to receive care if they fall ill. You know, while they're here, they're contributing to the economy. You know, they're spending money, investing in the country. You never know when you're going to become ill. So I'd like to think if I was in a foreign country, I'd receive treatment.
What do we mean by non-urgent? What do we mean by non-urgent care?
I think it's very important to be clear.
Yes.
Nobody in government is proposing that if you come over from another country and you have to be picked up by an ambulance and taken to an A&E and you're seriously ill, that you will be charged. This policy that developed today, we need to get more details, refers to routine and non-urgent care. Now, I agree there's a bit of a grey area around that, but I think it probably is being interpreted if you go in for an appointment which in a hospital, an outpatient appointment leading to some form of routine surgery, that would be something where they check your ID and see if you're entitled to free NHS care. But I think it's very, very important to say, I don't think anybody wants to stop emergencies being treated, whichever country you come from.
But you get a bill afterwards under these plans, or you're supposed to be charged afterwards?
There was, I mean, Jeremy Lefroy might have more details in terms of what you've been briefed, but there was a plan to extend it so that if you went into A&E and then needed to stay a few nights and needed surgery as a result of that, you would have to pay for that. But Jeremy Hunt, I think, announced that that had been put on hold for now. Today's policy is all about dealing with the routine and non-urgent care and whether hospitals are being effective at charging for that.
So you think that's a good idea? You disagree?
I think it's a good idea because you should only be able to get access to it if you put money into the system. My stepson came from America he was charged £50 at A&E when he hurt his arm. We didn't mind paying for it. He's not paying into the system.
He could afford it, though.
Yeah, well, it's about... I mean, and there are also other things. You don't need to go to the doctor for everything. You know, sometimes the pharmacy can cover lots of things, you know. And I think sometimes charging them might make them think twice, do I really need to go? Urgency, I totally understand.
OK, let's ask the next question. Thank you, Pretty. 4 in 10 in England would support increasing income tax to fund the NHS, and more than half in the UK would support increasing national insurance to fund the NHS. Stick your hand up if you agree with that and haven't yet spoken. Yep. Who's got my microphone? I think you had it. Thank you. Cheers. Hi. Good morning.
Good morning. Thank you very much.
What's your name?
James Welling. I think hopefully can speak for quite a lot of folks here. If we can get guarantees from the government that it be ring-fenced and it be spent on extra staff, extra services, and not put into another department, say, for helping with future wars, whatever else. If it's ring-fenced, I think people will be willing to pay extra.
So would you? So what, a penny on income tax?
Yeah, of course,
2p?
yeah.
5p?
Yeah, but we need to be able to follow the money, so to speak. We need to know where it's actually going.
Yeah, OK. Thanks, James. Thank you. Hi. Agree or disagree?
I disagree. My name's Mike Foster. I'm from Huddersfield, and I'm concerned that this is the wrong question, again, because unfortunately we have the money currently in the NHS system. The government has a lot of money. The minister or the MP needs to answer the question that's been put to him. £22 billion more is going to be cut from the NHS budget by 2020 by this government. That money should be refunded. We have a £3 billion deficit, and someone has talked about a PFI debt. We need to cancel all the PFI debts, and then the NHS will be awash with money instead of us having to pay more.
OK. Hello. Do you agree or disagree, madam, in terms of increasing income tax or national insurance?
I agree with increasing income tax, but not national insurance. We've paid national insurance, the older people have, throughout our working years, and we shouldn't have to do that again. Let me say, I'm chairman of the Lewisham Pensioners Forum, and we were instrumental in campaigning against, campaigning to save the NHS, as well as to save Lewisham Hospital. I just had to get that one in.
Well, you did it, and you did it very well. And we barely noticed.
I wanted to comment also on what the GP said. We need more GPs, we need more doctors, we need more funding. I mean, especially in my case, talking for older people, we shouldn't have to go and queue for half an hour or an hour to get to see a GP. We would like consistency, stability. We don't want to be changing doctors every time we go to the surgery. We would like to see the same GP to get accustomed, to build confidence, feel comfortable with that GP, rather than seeing different people every time that we go to the hospital.
OK. Hello. Do you agree or disagree in terms of putting up income tax, if it was ring-fenced to pay for the NHS?
Yes, I agree.
National insurance?
I agree with that as well.
You would do it. You would vote for a party that had that in its manifesto at the next general election?
Yes, and I'll tell you why. I've been my name's Stuart Smith. I've been an NHS patient for 39 years. I'm now celebrating 21 years as a transplant patient.
Whoa.
Thank you. The reason that I agree is because I owe my life to the NHS, and I will owe my life to the NHS for the rest of my life, and I will need another transplant one day. This is not going to last forever, I realise that. And if you've ever been ill, if you've ever known a family member that's been ill, in my opinion, you will change your view on whether you think that it should be increased in income tax or anything else. In my view, you have to look at where the money's going. There's no good keep pumping money in NHS if we're going to be overcharged in supply and procurement, if we're going to be overcharged with managers getting six-figure salaries. Even the Quality Care Commission, six-figure salaries. They're not doing their jobs correctly. Yeah. We need to have people doing their jobs correctly.
Hello.
Hi, my name's Leslie Channon. I guess I really love the NHS. It's helped me after I had my last son. I had really severe postnatal depression. And I agree with raising taxes for everyone. I've experienced the healthcare system in America where I had to pay $300 a month just to be insured. I had a spinal cord injury, and it ended up costing my insurance company, I was in hospital a week, $150,000. I was in rehab for 9 months. I didn't know if I was going to be able to have children. If I hadn't had insurance, I would have been responsible for that debt. And George W. Bush wrote into legislation that people cannot file bankruptcy on medical bills, so people are losing their homes when they get sick. So I think as a society, this precious NHS that we have, we shouldn't be blaming one person because they get cancer or one person because they need a transplant. I think as a society, we have agreed with this NHS to share the cost equally.
Okay, thank you. Good morning.
Coral Jones, I'm a GP from Hackney, and I just want to talk in the general about charging and where the money goes. And it was interesting that you quoted that figure of private involvement in the NHS, because I think that is a massive underestimate. The NHS spends millions and millions and millions of pounds every year on consultant managements, in high fees for general managers within the NHS, and also there's a lot of back office functions such as the CSUs, which are largely, they're kind of people that run the back office functions that behind a lot of, and they're being amalgamated, so there's more costs all the time. And the government's response to chronic underfunding in the NHS is to say that we now need a new complete upheaval in the NHS called the Sustainability and Transformation Programmes. So that's the NHS is going to be divided up into 44 areas. We're going to have, and my area has already spent £7 million just on the reorganisation, and nothing's happened yet.
Wow.
And it's not even a statutory body. And these reorganisation is just going to lead as a disguise for cuts. So we need to.
How will it? Yeah,
so the aim of all this is to cut funding. It's going to close A&Es, close services, not build hospitals, which is needed in the East End.
Let's bring in Jeremy Lefroy then, Conservative MP. Here, speaking as a constituency MP, but also it's your government, your party in government right now. Some people think that you are on a secret path, your government is on a secret path to eventually privatise the NHS. And this programme of efficiency savings / cuts, whichever phrase you want to use, is a way of breaking the system so that when they reach the day when they go, you know what, we're going to privatise everything, people will go, oh, thank God for that, because it's such a mess at the moment. Is there any truth in that?
No, is the answer.
Why? Okay,
excuse me.
Let him speak and then you can respond.
Absolutely not. And if there was, I wouldn't be a Conservative MP. It's as simple as that. Now, the gentleman also spoke about the 22 billion. Where that figure has come from is that before the last election, the NHS produced its own plan saying we need an additional £30 billion over the coming, in real terms, over the coming 5 years. And the NHS itself, Simon Stevens, said, we will find efficiency savings of 22 billion, but we need an additional £8 billion in real terms of funding in order to meet this 2020 target.
Yep.
And that is where that figure comes from. It's not about cutting money, it's about additional money, but the increased pressures that the NHS was going to face and is facing over the next, from then it was 5 years, it's now 3.5 years, meant that those savings had to be found. I personally think that that 2020 plan was ambitious.
Okay, I'm going to pause you there.
I think we need, sorry, if I can just finish, we need to get into our heads that this 22 billion is not money that somehow come out of the NHS. It's addition. It is not. And I think Hugh may be able to explain that.
Yeah, I mean, I do agree with Jeremy Lefroy there. It's a difference between a predicted increase in demand of 30 billion by 2020 over 2014-15, and where does that money come from? Well, the government says it'll chip in 8, so the government has pledged more money, but the debate now is how you go further to get to the 30. Does it need more government money, or does it need the NHS using the 22 billion or a bit less, being more efficient to close that gap. And
Right.
that's partly what these sustainability and transformation plans are about.
All right, hang
well,
on.
okay, or just to add,
Yeah.
part of this is about treating more people in their local community rather than being in a hospital. Is there a better use of the money? That is the logic, but there's a lot of scepticism about whether anything like 22 billion can be found by doing that.
Over here, sorry.
Jeremy's absolutely right. If the Conservatives privatise the NHS, they'll be out of office. People will vote them out. I mean, Jeremy's there saying, as a Conservative MP, I won't even vote Conservative if they privatise the NHS, and nor will I. And the Conservatives will be out if they privatise the NHS, because we live in a democracy.
Okay.
And no one wants that.
Sir.
So I'm sorry.
So hang on a minute. Do you believe this Conservative MP
No, I
when he
don't.
says
no, I do not.
there is no secret?
Absolutely not. I actually disagree with what you said, Victoria, because you said they're trying to. Are they trying to secretly privatise the NHS? I don't even think they're trying it in secret anymore. I think it's just completely explicit. I think you know what we've been talking about is incessant amounts of cuts. This Sustainability and Transformation Act is just about closing down hospitals, centralising services. I work at the Royal London, which is a major trauma centre, and we cannot cope with elective work anymore because what they've done is they've closed down A&Es. We've seen it in Grantham.
Let me ask you this question. Who would vote for a party that promised to privatise the NHS?
Well, exactly, which is why you have to show that the NHS
What's
is
the
failing.
answer to that question?
Which is, exactly, they won't explicitly, but they will if they show the NHS is a service in failure. If they show the NHS and then the white horse of privatisation comes in and says, well, actually, we have a viable alternative, then they will vote for it.
But for me, they need to look at where all the money's going. There's no good keep pumping money in if we're going to. I mean, like how many MPs and consultants have links to the Conservative Party? The Quality Care Commission is made up of people that are consultants. They've got all links as well. They're the wrong people. You need to have. There's not.
Look at where money is being lost. You've got to look at, and this is money being siphoned off.
John Ashworth for Labour. Do you, as a Labour MP, think there is a plan from the Conservatives to slowly privatise the NHS?
Can I just say in Jeremy's defence, I think on most of his answers, he's shown he's not a typical Tory on the NHS, to be fair to him. So let's not all gang up on him. I would say, look, we're seeing more private involvement in the NHS.
Started by a Labour government.
It did start, but now the Health and Social Care Act, which the Conservatives brought in, has put rocket boosters under that exercise. There's now in Durham, I think it is, a private firm steps in when the GPs have made a referral. The private firm then steps in to check and decide whether the GP was correct or not to make that referral. I mean, that's absolutely disgraceful, isn't it? And on this point about SDPs, there's a very eloquent explanation from Hugh on the economics of it. But the reality is, across the country, we're going to be seeing beds cut, A&E departments closed, on the front page of some of the papers today, maternity units closed, hospitals closed, and that's what this 22 billion is all about.
Okay.
Huge cuts to services locally.
All right, I want to ask the panel here, what would you charge for, if anything? Sir, remind us who you are.
Sean Nagpal, I represent the doctors in the UK, British Medical Association. I think this is completely the wrong question. We're deflecting.
Just answer the question. and then you can tell me it's wrong. What would you charge for? Nothing?
I would not charge. I would fund the NHS properly like every other developed nation. That's what I would say, right.
Okay.
I agree that charging is an unhelpful distraction at the moment. The amount of money we could reclaim is so small as to make it a major distraction, because the people who would pay are those who are actually really struggling at the moment. Those who are already unemployed and fully resourced through social care would not pay anything anyway. Okay. Those who are vulnerable, elderly, children wouldn't pay anyway. It is the people who are working very hard and already contributing via tax and contributing and finding it hard just to pay a prescription fee. People say to me, Doctor, of these two drugs you've given me, which is the urgent one? Which one should I take today? Because they can't even find a prescription fee. So adding fees to beyond that is just going to make the sick sicker.
Okay.
Sorry, I speak for children. Children have no voice. This is a huge distraction. There is money in the system. Let's take the internal market, abolished in Scotland and Wales. It would free up something between 3 and 5 billion a year. Let's take PFI repayments, which someone talked about. They should be renegotiated centrally. They've already been renegotiated piecemeal in some areas of the country. It should be done nationally. That's costing the NHS 2 billion a year. What about the external market? The Department of Health's own figures, 6.6 billion going into for-profit companies this year. Add up those figures, you've already got you've already got about £12 billion a year which could be going into the NHS. So talking about charging for services, which is less than 0.5% of the NHS budget, is a huge distraction. It's not a question we should be considering.
Right, I'm going to have some more stories. I want to hear from this lady. Good morning.
My name is Sylvia Parks. I worshipped the NHS up until the 8th of October 2015. Before that, I had two sets of grandchildren, two of my daughter, they had twins, and they were in the special care baby unit, and they were fantastic. The nurses were fabulous. On the 8th of October, my daughter, 26 years old, went into hospital to have her baby, and she died during childbirth. The baby, of which they wanted us to switch the machine off on the same day that she died, she survived. She's 16 months. She has a grade 3 brain injury and she's blind.
Wow.
I just want to say that we didn't anticipate that happening. She walked into hospital. She went the 7th of October. She was sent home. We were told that if everybody had come in at 1 centimetre dilated, then the hospital wards would be full. She had an underlying problem, which was a megarectum, and that was seen on 3 scans and not acted upon because they wasn't sure what it was. That cost her her life. And I'd just like to say that how many lives are going to go, like my daughter's, before something is done about the NHS. We paid dearly, and we are still paying dearly. We are still having problems accessing services for my granddaughter, who we have legal custody of now. We were told the other day that they have to be careful how they spend public funds. The baby doesn't sleep at night. She sustained a brain injury, and because of that, she doesn't sleep. I'm about now to give up work. I'm working my notice to take care of my granddaughter. Who's going to help us?
Oh, wow. We are so sorry. We are so sorry. I know this lady here would like to talk to you.
Firstly, my sincere condolences to you. I know the pain of loss. My name's Elaine Hansack, and I speak and write on perinatal mental health, which is around antenatal and postnatal depression. I've done that for the last 12 years. I was very ill 20 years ago. I could have been one of those very sad cases of new mum's body found on a railway line. I survived, and thank you to the NHS and everyone that supports me. But now I speak on behalf of other ladies, other families who have been left without their mother, and in some cases father, because of poor mental health care, postnatally and antenatally, and because of the very, very strong pressures under midwives at the moment. I spoke to midwives last week on a training day, and one lady said there are 2 midwives coping for 27 people at any one time. People in the midwives, I think, do an incredible job. I really do. And yet they are pressured. Our whole society is based on new lives. And mothers and fathers, we all need supporting. And I think as a society, we've forgotten to nurture our families. We've forgotten or we're not remembering how precious new life is. And especially when it's betwixt and between, when we have bereavement of a loved person at the same time of joy. We have to put more into perinatal mental health services as the NHS and society as a whole.
Thank you. Thank you, Sylvia. Thank you. Hello, good morning.
My name's Rebecca, and I'm a big fan of the NHS.
Rebecca, put your microphone on.
I had a stroke 2 years ago, and I can honestly say the support I got from the NHS was superb. But in my recent role as volunteering, I speak to a lot of stroke survivors, and a lot of them say they haven't had that same experience, particularly when they're discharged from hospital. That when we did a survey, 48% of those stroke survivors felt alone and totally unthought about after they'd been discharged. It's a postcode lottery.
Right.
Some areas you get really good service when you get out of hospital. Other areas you get absolutely nothing. There's 1.2 million stroke survivors out there, and for that, so many of those end up with permanent, life-changing differences, and they need support, whether it be mental, whether it be physical, speech, and there's a lot of the CCGs, like the clinical commissioning groups, when they start looking at funding, they take away some of that funding, where sort of like the Stroke Association, who I help with, go out and they have groups in that borough or in that council that help support those stroke survivors. That funding is slowly being taken away, so they can't do that for that council or that borough anymore.
Okay, thank you. Hello.
Hi, my name's Chris Key. 3 years ago, I was diagnosed with depression and anxiety, and unfortunately, the NHS couldn't do anything for me. I had to spend £4,000 of my own money, and if I hadn't spent that money, and without lying, I'm not sure I could still be here today. Because this concept of charging, it's already happening. I've paid a lot of money, and every single year, 6,000 people are killing themselves. Every time we run a programme, one person will have killed themselves in this country. We have got to start taking mental health more seriously and commit and spend the money we say we're going to commit, because we're not doing it.
Okay. Yeah. For the last 15 minutes or so of the programme, we're going to talk about government plans for a 7-day NHS. Should you be able to book an appointment at a GP in the evening and at weekends? Should routine operations take place outside office hours? Have a look at this.
One of the government's most ambitious plans is to make the NHS in England a 7-day service by 2020. It was a key pledge of former Prime Minister David Cameron.
With a future Conservative government, we would have a truly 7-day NHS.
Now it's been taken on by Theresa May. Her government envisages people having access to local GPs 7 days a week. It recently announced that GP surgeries that fail to open at evenings and on weekends could lose their funding. Patients, the government say, should also receive the same level of urgent and emergency care in hospitals in England at weekends as they do Mondays to Fridays.
Save our NHS! Save our...
This was at the centre of the junior doctors' contract dispute last year. Junior doctors already work on weekends and in fact represent the bulk of medical professionals on shift. Tweets targeted at the Health Secretary last year using the hashtag #I'mInWorkJeremy were keen to prove this point. But while emergency care is available at weekends, staffing levels are much lower. Health Secretary Jeremy Hunt has caused controversy by suggesting a lack of staff was behind the higher weekend death rate. He said 6,000 deaths a year were caused by a lack of a proper 7-day service, citing an unpublished paper at the time. But emails show one of its authors was unhappy with how the study was being used. Some experts believe other factors must be considered when analysing the higher death rate, such as how patients admitted at weekends tend to be sicker than those admitted during the week, and that there's no evidence to suggest extra staff would prevent so-called excess deaths. Staffing concerns, however, haven't been limited to England. The Public Services Ombudsman in Wales called for a systematic review of out-of-hours hospital care last year, while Scotland's First Minister Nicola Sturgeon announced in 2016 that minimum staffing levels in Scotland's NHS will be enshrined in law. In May 2016, it was announced a deal had been struck with the government over junior doctors' new contracts. But whether this will lead to a truly 7-day NHS is unclear. Leaked Department of Health documents released in August last year worried that a lack of available GPs, hospital consultants and other health professionals would mean the full vision would not be realised. Government sources said this was a normal risk assessment.
Hugh Pym, our health editor, is here. What does 7-day a week mean in practical terms? Because, of course, people say we already have a 7-day a week NHS.
Well, indeed, Victoria, it's become a massively contentious issue. It was at the centre of the junior doctors dispute, where junior doctors were very angry to be told that there were changes in the contract which would result in more of them working at weekends to provide better care, when actually they were already working several weekends, actually 1 in 2, 1 in 3 or whatever. Then there's the issue about getting more consultants into hospitals at weekends. There's a general view that actually There could be changes to have more consultant cover and provide better hospital care over the weekends, but there are talks ongoing with the BMA about that. Then there's GPs, that's proved very controversial as well. Attempts to get more GP access after office hours during the week and at weekends, when GPs are saying, well, we're already doing that, and actually we sometimes open at a weekend and offer appointments and nobody wants them. So it's highly controversial, but there's a lot of different aspects to it.
Okay. Hi.
Hi, my name's David. I'm a staff nurse in A&E. I think the government deliberately deflects from what the issue is. This issue of a 7-day NHS, I don't think the public really want an elective 7-day NHS. What they want is a fully funded 7-day emergency care and 5-day elective care. And the problem is that we have been defunded for the last 6 years. As one of our contributors said earlier, you know, used to be 4 to 6% added on every year to account for things like increased pharmacology costs, technology improving, and obviously people getting older. And that was stopped in 2010. So we've been defunded for the last 6 years, and that's why we're in crisis now. What's going to come up has already been said about this cliff edge of the STPs. These 44 areas that we're not going to have an NHS in 2 or 3 years, because what's happening is we've been divided up into these 44 footsteps. Mine is Oxfordshire, West Berkshire and Buckinghamshire. Where I am, they're looking at cutting mental health services by £4 million. They're talking about cutting staffing, which is most staff are nurses, so the majority of these cuts will come to nursing, £34 million in cuts.
Okay.
And that is going to significantly affect the number of beds we have. Social care is going to affect everything, and we're going to fall over.
Are you a final year medical student? Hello.
I am. Hi, I'm Talia. I'm a final year medical student. There's a couple of points I want to say. Firstly, in relation to that, the 7-day NHS, what we really need is more allied health professionals, so radiographers and pharmacists and people working on weekends to have a fully staffed NHS 7 days, fully staffed emergency cover 7 days a week. What we don't need is people to have elective operations on a Sunday.
Yeah. Give our audience an example of an elective operation. You mean what, for example?
A carpal tunnel decompression.
A what?
Sorry. What? A hip replacement.
Fine, hip replacement, perfect.
Sorry. But what I would say is that this is kind of circular in that we're saying that there aren't enough doctors, it's underfunding, and what's happening is the morale is so low. You said that 2 years ago you had a stroke and the care was excellent, and people today aren't having that same level of care. And I would say when I started medical school 6 years ago, the morale, the way it felt to be in the NHS was different. And actually the first thing that goes is teaching, because that's not urgent. And so we're not getting, us and junior doctors aren't getting the same level of teaching, which is going to have a knock-on impact for a very long time. And as a result, people are seriously talking about leaving, and many junior doctors and consultants say to us, get out. And they say it to us every single day.
What are you going to do? Your final year
and I'm not sure. I'm not sure seriously, whether I'm going to leave the country and still be a doctor, or I did a degree in healthcare management, also maybe management, maybe, you know, and I've got friends who have taken years out to work in pharmaceutical companies because it's insufferable. And my friends who are already junior doctors, they're working 1 and 2 weekends. There is a 7-day NHS and it's exhausting.
But sorry, what's your name again?
Talia.
Talia and David, are they onto something in that you're not bothered about a hip hop at the weekend? That's fine, Monday to Friday, but you want the emergency care over the weekend? Decent emergency care. Yeah, is that what?
Yeah.
Okay. Hello. Thank you, Talia.
My name is Beulah. I used to work for NHS, but unfortunately I can't continue working for NHS through the operation I had the thyroidectomy.
I'm going to ask you to move the microphone a little bit closer to your mouth.
Okay. I had a thyroidectomy in 2004. After that, I'm still having problem of low calcium, magnesium, potassium. So it's like I'm in and out of hospital. I go to my GP today. My GP said, go to hospital to get the infusion. I go to hospital. They said, go to your GP. So I'm now confused. I don't know where to go. If I go to hospital, they say, go to the GP. The GP say, I can't give you the infusion here. Go to the hospital. They are the ones who give you the infusion because you need to be on a monitor. So I don't know what to do now. I'm just walking, but I don't know. My GP phoned me Last week on Thursday, they said, can you go to hospital? I can't because I'm tired. Every week I'm in and out of hospital. My hands are hurting because of needles. So it's now 10 years I've been going through this.
Really?
Yes.
And so this issue of, Sunday
this is
to
my
Sunday.
life. They said this is your life until the last day of your life. So I said, can you just, arrange something? I don't mind having the infusion in my house. There's nothing new. I've got all the drugs they are giving me. I've got the injections, all morphine, everything. I've got it in my house. I won't kill myself. I won't do any harm to my children. Why don't you send a nurse or once a week just to do the infusion? I don't mind.
Yeah.
Rather than me going to A&E, every time I go, I have to join the queue in A&E. Sometimes you spend the whole night, 2 nights in A&E on a trolley.
Yeah. Okay.
The next day, go home.
It's tough.
You go home again, go back to the hospital. So I'm like, why? I want to know, if they can do something, just, to keep me like in one place. I know, whatever is happening, I'll die eventually. Last year, they called me on the 20th of October saying, when you were in hospital, we did an MRI scan. We found you've got a big lump. Your liver has got black spots. You've got all this. And I'm like, okay, fine. Go and see your GP. This is a phone call. I went to my GP. I said, this is what the message I got from the hospital. My GP was like, I don't have any report. So it was like, I'm going back and forth. Now, when I was there in my GP surgery, one of the nurses called from the hospital. Then my GP, I gave him the phone. I said, talk to him. It was like, I don't know anything. She's telling me I'm appearing stupid in front of her.
Yeah.
Because what you are saying now is different.
Let me bring in a representative of GPs. This case is really, really sad, unbelievably frustrating for this lady. Is that the kind of thing, that sort of toing and froing that you're seeing? And do you have demand from your patients to see them on Saturday and Sunday?
There are so many things in this case. So first of all, the joined up working is something that we can all do better, but we need better IT infrastructure. There's no way that we should be waiting for phone calls and faxes when we should have electronic infrastructure to convey information in an efficient way. So that's a bit of a no-brainer. It should be better. It could be better with resource. The 7-day argument is so powerful because, of course, in an ideal world, we'd all love to have our blood pressure on Sunday afternoon if we could. But the reality...
Well, would we? I'm not sure I'm bothered about that.
Well, it's interesting because actually we've, a lot of money has been put into opening surgeries, GP surgeries on a Sunday afternoon, and patients don't turn up because actually people do want a life. There are some people who are working very hard in the week who would like more routine access at the weekend. But if we cannot provide a safe, comprehensive in-hour service, that's the 5-day service, plus a comprehensive, safe emergency service for our patients, both in the community and in hospitals, then the 7-day argument for routine care is spurious and it's a distraction.
Okay. I'm going to ask this gentleman here. Sorry, I'm going to borrow your mic. Sorry. You work for Pulse magazine, I'm reliably informed.
Yes.
What is the evidence in terms of demand from patients?
Yes, so we've looked very closely at the evidence for 7-day access in GP surgeries, and the evidence does show that it reduces people's tendency to go to A&E, but it doesn't reduce the more serious patients. The more serious patients will still end up in A&E.
Yeah.
And also, if you look at the attendances, often on a Sunday afternoon, let's be honest, patients have something better to do than turn up for their GP surgery. And also, I think that it costs twice as much than routine GP care. And
what, at the weekend?
Yes, for the weekend care.
Right.
So if you think about, we've looked at the numbers, it will cost around about 1.5 billion for this policy by 2020. Think about how that money could have been used during the 5 days during the week to reduce the waiting times for a routine GP appointment. And also, I think there's a fallacy as well. The government says you'll see your GP 7 days a week. It's not your GP. It's a hub somewhere, often quite a distance away. And that lady there who was talking about, she wants to see her GP. She wants to get the care from someone she knows.
Yeah.
If we're talking about cost versus value, it's often better to see your GP. In the long run, actually, you'll get better care and it will be cheaper in the long run.
I'm going to give that microphone back to this lady. And literally, you've got 30 seconds because we're coming to the end of the programme. Really quick.
OK, well, I have a long-term condition called ulcerative colitis, and I've been treated over the years by the NHS at Christmas and at New Year. And we not only have a 7-day NHS, in my opinion, we have a 365-day NHS that will treat you at all times of the year. And the one last thing that I wanted to say is that the charity that works on behalf of my condition, which is Crohn's and Colitis UK, they're really pushing at the moment for more specialist nurses for long-term conditions, which would help a lot of other people as well.
Thank you very much. Thank you. Let me tell you that at 12:30 today on the BBC News Channel, we'll be taking your questions on health, so-called health tourism, and how we should handle pressures in the NHS. Do get in touch by text or send an email or contact us via Twitter using the hashtag BBC Ask This. Thank you very much, all of you. Thank you. You've been magnificent.